Hello guys, welcome back to my channel. In this video, we are going to study about RETT syndrome and Asperger syndrome, which is an important topic about INI-SET and NEET PG. First of all, we are going to study about RETT syndrome. So, we are going to study only the most important things about RETT syndrome. So, first of all, RETT syndrome is seen only in female child. Next thing, the common age of presentation of RETT syndrome is 6 months of age. And the inheritance pattern is X-linked dominant disorder, and the gene implicated is MECP2 gene. I have also put a page of RETT syndrome from first aid. As you can see over here, RETT syndrome, it is an X-linked dominant disorder seen exclusively in girls. Affected males die in utero or shortly after birth, and MECP2 gene is implicated. Age is around 1 to 4 years of age or 6 months of age, as it is given in NEET PG type of questions. Characterized by loss of development and loss of verbal abilities, stereotyped hand wriggling movement, no longer a solitary diagnosis in DSM-5. So this is given about RETT syndrome in first aid. What is important about Asperger syndrome? The IQ in Asperger syndrome is normal. You have to remember this. Language is normal, but repetitive movements and decreased eye contact is present in Asperger syndrome. So now we are going to study about the summary of all autism spectrum disorders. First of all, if there is decreased eye contact and repetitive movements, you have to think about autism spectrum disorders. If IQ is normal and language is normal, then think about Asperger syndrome. If the language is decreased, then see regression. If regression of milestones is present, then either it will be Heller syndrome or RETT syndrome. We have already studied about RETT syndrome, that it is an X-linked dominant disorder. It is seen only in females in 6 months of age, while in Heller's disease, it is seen in 2 to 3 years of age, and it is seen both in boys and in girls. So this is important about Heller syndrome. And if the language is decreased and regression is not seen, then it should be autism. So this particular thing I have taken from Zanavura ma'am's BTR session. So this is very important, what I have told you in the summary part, and this will help you solve question. Nothing else is important above this. The only thing which is important and which will help you solve questions in NEET PG and INI-SET is this part only. This is enough as far as INI-SET and NEET PG is concerned, and a lot of questions come from this topic, so you have to prepare it properly.